Namaste everyone. I am Dr. Krishna Kishore, consultant nephrologist with Kaveri Hospitals, Bangalore. I'm going to talk about one of the most common diseases that affects kidneys in people. It is going to be kidney stones. I'm sure that many of us will be wondering why these kidney stones form in people and how common they are and what should we do to prevent them from happening and how to treat them in case they happen. So kidney stone disease is one of the most frequent diseases occurring across all age groups of the population, most commonly between 20 to 40 years of age. It is predicted that approximately 5% of the total population are affected by kidney stones at some stage of their life. It is also predicted that men are more commonly affected than women for reasons unknown. So the recent increase in the frequency or the prevalence of kidney disease stones can be attributed to the changes in the diet and urbanization. So the first question comes, who gets these kidney stones? So we can classify these risk factors as modifiable and non-modifiable. The first thing is modifiable, which means that we can bring some change in these risk factors so that it doesn't affect a particular individual for the kidney stones. In that, the first point I would say is low fluid consumption, having low urine volume. Somebody consuming less water, they are more prone for getting kidney stones. So the next question comes, how much water should one take? So we can put it as an individual should pass at least 2.5 liters of urine. So it depends on the climatic conditions where they live to decide on the total consumption. For example, somebody who is living in humid climates, they might have to take at least 3 to 3.5 liters as compared to people who are staying in cooler climates at around 2 to 2.5 liters of fluids to be taken in a day. So that's the first point I would put it as somebody consuming less fluids. And second is consumption of high oxalate rich foods, which are so commonly high protein foods, more meat consumption. These are associated with increased kidney stone formation and higher calcium containing foods. So overconsumption of dairy products may result in calcium stone formation. So one should be careful about that. And higher protein intake can result in uric acid formation, which leads to uric acid stones in the kidney. So these are the two things I would say as the first things. And then next is sedentary lifestyle. Somebody not having regular physical activity, that can lead to stone formation too. So some of the foodstuffs which can lead to stone formation include, as I said, the meat and excessive dairy consumption and excessive oxalate rich foods, especially the vegetables which are rich in oxalate like phytates and increased green leafy vegetable intake, we should be careful about. And based on the type of stone, these are classified into calcium stones, which contribute to 75 to 80% of the stones, and next comes calcium phosphate stones. First one is calcium oxalate, followed by calcium phosphate stones, and then followed by uric acid stones, which contribute to almost 95 to 99% of the stones, and a very small percentage is contributed by cystine stones and struvite stones. So oxalate, as I said, one is the diet and the other one is the absorption. The people undergoing some procedures, some surgical procedures, they might be more prone for oxalate stone formation in kidney stones, especially those undergoing bariatric surgeries, means the surgeries that are done to reduce weight, and some intestinal surgeries, the surgeries that are done inside their tummy for obstruction or various kind of diseases. When the length of our intestine comes down, the oxalate is absorbed more, and when it is not excreted appropriately, it can lead to stone formation. So these are the types of stones, and these are the foodstuffs that one has to follow, and these are the surgical procedures that might lead to increased stone formation risk. So next, what are the non-modifiable risk factors that somebody can have? So we can see that stone formation usually happens within the families. So there is always a family history. So somebody known to have stones within the family, they should be very careful to prevent stone formation in them by consuming lots of water and by avoiding diet which are rich in oxalate, and as well as increased calcium intake is avoided in them, and increased uric acid material like increased protein intake has to be avoided in these individuals. And next one is genetic history. There are some genetic diseases which are associated with increased oxalate levels in the blood. This is because the metabolism of that compound is limited. In these people with genetic diseases, they end up having oxalate stones, and some people with these diseases, these genetic diseases, can end up with severe kidney failure too, requiring a kidney transplant or going on for dialysis. So the non-modifiable factors, though we cannot do anything, we can take precautions to prevent the formation or reduce the rate of progression of the kidney disease. And next one is recurrence. So the question is, if somebody has a kidney stone, what is the chance of them getting that back again? Would they be getting back at all? So the chance of recurrence is much higher as the time goes by. For example, chance of getting kidney stone again in a former is around, we would say, 15 to 20% in 1 year. At the end of 10 years, it come up to 50%. So once you're a stone former, you may remain a stone former. So that's the reason you should be under follow-up with the doctors and then find out whether there is a new stone formation or increase the size of the stone that's already formed and take adequate measures to either remove the stone or ensure that it doesn't increase in size. So this thing has to be remembered, that a stone former has to be under regular follow-up with the doctors to avoid complications due to the same. And when would somebody require treatment, and how do we know that somebody has a kidney stone? So in other words, what are the clinical signs and symptoms in somebody having kidney stones? Most commonly they present with pain. So the location and the character of the pain will tell us whether that's because of the kidney stone. Usual site of the stone pain is in the flank. That's either side of the flank, where the pain radiates from back to the front. So this is the classical pain, what we call colicky pain. So the pain is so severe that they cannot lie down still. They'll be writhing in the bed and with severe pain. So this is one of the common symptoms that they have. The other symptoms include change in the urine color. Some people may have blood in the urine, or some people may have burning sensation while passing urine, and some people may have associated fever, vomiting and nausea. So it also depends on the location of the stone, size of the stone, and how fast it is moving down the track. So these are the classical signs and symptoms. Then how do we diagnose somebody having kidney stones? Once they present with classical signs and symptoms, the simple investigation that we do is ultrasound. We do an ultrasound to find out if somebody has a kidney stone, the location of it, and if it is causing any obstruction to the urine flow. And how do we treat them? The people with the kidney stones would be treated either medically or surgically. So it depends on the size and the location of the stone, like in which part of the kidney tract the kidney stone is located. If the size of the stone is smaller, that is less than 5 or 6 millimeters, most of the time we expect the stone to come out on its own just by drinking lots of water. But if the stone is bigger than that and it is obstructed and it's not moving in its course, then it requires a surgical intervention where we have to consult a urologist for the further treatment. These stones, most of the time they are very benign, so they may not lead to major problems, but it depends on the number of stones in the kidney. There are some diseases where there are multiple stones that are there in the kidney, obstructing the urine flow more often and leading to kidney failure. So as I said earlier, a stone former has the chance of recurrence again, so they should be under regular follow-up to ensure the disease doesn't worsen.